Hello everyone, my name is Oleg Nikolenko and my team members are Tenzin Dolker and Tatiana Vasilyeva. The topic of our presentation today is task-oriented training for children with cerebral palsy and functional independence at home. Our presentation outline is following. First, study purpose. Second, research question and hypothesis. 3. Need for the study. 4. Background literature. 5. Methodology. 6. Findings. 7. Discussion, limitation, implication, and conclusions. 8. References. 9. Acknowledgements. The purpose of our study is to investigate the effectiveness of different types of task-oriented training on functional independence at home in children with diplegic or hemiplegic cerebral palsy, in improving functional independence at home. These types of task-oriented training include, but not limited to, constraint-induced movement therapy, which is a specialized approach used to increase the use of affected limb by restricted unaffected limb and practicing desired task for 6 hours a day. Hand-arm bimanual intensive therapy that is similar to constraint-induced movement therapy, but not involve restriction of the unaffected arm. Bimanual task-oriented therapy, which is a program that is individually tailored to the child based on task analysis of selected goals. Occupational therapy home program that is focused on the goal-directed child-executed activities, environmental adaptation to promote goal achievement, and parent education to enhance the way in which child learn. Goal-directed functional therapy is the approach that includes identification of individual tailored treatments goals to increase motivation and goal achievement. Task-specific training that is essentially just another name for task-oriented training. Our research question: is task-oriented training effective among children with diplegic or hemiplegic cerebral palsy in improving functional independence at home? Our hypothesis is that task-oriented training is an effective intervention among children with CP in improving their functional independence at home. Nature of the problem: cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. The disorders appear in the first few years of life. Usually, this disorder do not get worse over time. People with cerebral palsy may have difficulty walking. They may also have trouble with fine motor tasks. Some have other medical conditions, including seizure disorders or mental impairment. Cerebral palsy occurs when the area of the brain that control movement and posture do not develop correctly or get damaged. Early signs of cerebral palsy usually appear before 3 years of age. Cerebral palsy is the most common motor disability in children. About 1 in 323 children has been identified with cerebral palsy. The 4 major subtypes are spastic, dyskinetic, ataxic, and mixed cerebral palsy, with spastic forms being the most common. Spastic cerebral palsy, which is also known as hypertonic cerebral palsy, is characterized by increase in muscle tone and leads to stiff and sometimes painful limbs. Brain damage that results in spastic cerebral palsy affects muscle control, coordination, and movement mainly in terms of arms and legs. Spastic cerebral palsy may be classified as quadriplegic, diplegic, or hemiplegic, according to how and where it affects the body. In this research, we're focusing on diplegic and hemiplegic cerebral palsy. Diplegic spastic cerebral palsy affects mostly legs and sometimes arms. Diplegic spastic cerebral palsy can cause dysfunction in coordination and balance, seizures, joint contractures, and cognitive impairments. Hemiplegic spastic cerebral palsy affects only one side of the body, and arms are usually affected more than legs. Children with this type of cerebral palsy can have difficulty with participation in everyday activities such as play, dressing, feeding, personal hygiene, and others. Occupational therapy is a science-driven profession that applies the most up-to-date research to the service delivery in order to provide best practice care for the client. Integrating high-quality quantitative and qualitative research for treatment approaches such as task-oriented training allows the practitioner to perform best practice care. However, several studies have suggested that clinical use of these guidelines does not always occur. Between 10 and 40% of patients, which includes children with cerebral palsy, who do not receive care based on current scientific evidence, and more than 20% of care provided is not needed or potentially harmful for these patients. Importance of the study. Occupational therapists need to use the best evidence-based practice that can help children with cerebral palsy to achieve higher functional performance. Task-oriented training is incongruent with the contemporary occupational therapy practice and has been evaluated in children with cerebral palsy. The evidence shows that task-oriented training improves upper limb function and ADLs in children with cerebral palsy. This systematic review is conducted to show the importance of evidence-based practice and effect of task-oriented training on functional independence of children with CP. Functional independence is determined by children's ability to perform daily activities independently. Participation activities indicate child's actual performance in his or her daily life. Therefore, occupational therapy is appropriately aligned with this particular treatment approach, because there is moderate to strong evidence in efficacy of task-oriented training. What is task-oriented training? Task-oriented training, sometimes called task-specific training, goal-directed training, task-related training, functional task performance, and repetitive task practice, is a form of therapy with which patients practice context-specific motor tasks and receive some form of feedback. The concept involves interaction between an individual, a task, and the individual's environment. These interactions are dynamic. This training is a top-down approach, focused on each client's goal. With task-oriented training, the child will practice everyday tasks and a wide range of interventions that involves meaningful activities with the aim of acquiring a skill. Task-oriented training involves practicing real-life tasks, such as dressing, with the intention of acquiring or reacquiring a skill. Task-oriented training based on motor learning theory has been studied and evidence supports its efficacy. Key elements of task-oriented training are collaborative goal setting and practice of functional goal tasks. Intervention should be goal-directed, working on the goals identified by children and their caregivers. Based on previous studies, there is evidence that task-oriented training, such as constraint-induced movement therapy, can be used to combat learned non-use of affected extremity for children with hemiplegic cerebral palsy. Constraint-induced therapy originated from the observation that unilaterally differentiated monkeys that normally do not make use of differentiated limb but can be induced to do so by restricted movement of the intact limb, and they will continue to use the limb even when the movement restriction ceases. This procedure was first used in human patients with hemiparetic stroke. Based on findings from previously done studies, constraint-induced movement therapy can be effective in treating children with hemiparetic cerebral palsy.